Hello, my friends and dear parents. This is Dr. Amish Mehta once again from Chandan Dental, Sampatra Colony, Vadodara, in the series of videos on the awareness for dental health. As promised in the previous videos, we talked about how dental diseases can be cured. In the videos prior to this, we touched a few topics about what is dental health, what dental ailments can happen, what dental diseases can happen to us, why, and what all home care that we can do. And once again I repeat, please visit your dentist every 6 months to 1 year, because many dental diseases are silent. They will not give you a complaint till an advanced stage. You might be requiring advanced treatment if you go to a dentist with pain. So regularly visit a dentist and get your teeth checked, so that early detection is best, and even better would be prevention of any oral health disease. So now you see, we talked about dental decay. So I just want to show you a model here. You can see this is how a tooth gets decayed and it can be filled. So you can use one of the restorative materials. In the previous days they used to use silver amalgam. Some dentists are still using silver amalgam. Some dentists used cement or resin, which is tooth colored. There are various range, and what is best suited for your treatment, your dentist is the best person to decide. But if the decay gets deeper, like we discussed last time, if it reaches the pulp, and as you can see here, the tooth has a pulp inside, which is the nerve and the artery over here, and if that gets infected, then a procedure called root canal treatment is done by the dentist to save the tooth. It is a conservative treatment. Maybe 5 decades back, maybe a century back, the deeply decayed teeth were frequently extracted, but now we can conservatively treat them by doing a root canal treatment, and we can save the tooth. Once the tooth is treated by a root canal, you must get a crown over it, because a dead tooth, which is a root canal treated tooth, tends to become brittle over time and it can break. So it is always better to have a good quality crown done. These days a very highly aesthetic strong material like zirconia, lithium disilicate, porcelain fused to metal, and other various materials are available, which can give you a good aesthetics as well as a good function. As you can see, the crowns here are made, they are milled. We have CAD/CAM technology now, and so single day dentistry is also possible. You can visit your nearest or your best dentist that you meet and get good guidance from him regarding what type of crown is best suited for you. For the gum problems, usually you need to see a periodontist who specializes in the treatment of the gum diseases, where the gums, if they are swollen or they are bleeding, or if there are pockets, and if there is a disease between the joint of the tooth and the bone, which is known as periodontitis, he or she, the periodontist or your general dentist, would perform periodontal surgeries to make the gums and the teeth more stronger. If by any chance you tend to lose the tooth, because if you fail to see a dentist in time, and if your tooth is lost and you have a single tooth or more than single tooth being extracted and removed, then of course the age-old thing is to get a denture made. These days very nice dentures are available, which are not as bulky as they were in the previous times. When you have all your teeth gone, this is the type of denture the dentist usually make and give you. Apart from that, you can also get a bridge done, or you can get an implant done inside the bone, which will replace the lost tooth structure. This is about the dental diseases, and right from the beginning of the initiation of the problem of dental caries or pyorrhea or periodontitis, it can be treated at various stages, from a very conservative treatment, preventive treatment, your interceptive treatment, which will stop the disease process from progressing further, or if it is beyond control, then you have to go in for replacement of the teeth. So the various options are available. Visit your nearest dentist as soon as possible, because it is very imperative that you replace your missing or lost teeth as early as possible, because otherwise the other teeth tend to move into that space and there are more further repercussions which might compromise your oral health care. Now for children we have lots of preventive treatment as well as preventive treatment for adults, and one of the most tried and tested scientifically published treatment is fluoride application, and these days many toothpastes have fluoride. There are certain rules and regulations in our country, in India, regarding the content of fluoride in a toothpaste. It should not exceed 1000 ppm. Using a fluoridated toothpaste is advisable, which will strengthen your enamel for progression of dental caries or initiation of dental caries. You can also use, we have lots of Indian Ayurvedic toothpastes available, which are also very good and which can help prevent certain dental diseases. Apart from that, for your gum problems, you can, basically see a dentist regularly so that he checks your gums and they are in perfect proper shape. Gums problems can be prevented mainly by good brushing, good gum massage. A gum massage is usually advised by a dentist, and you need to massage your gums and keep your gums healthy. There are certain systemic diseases like medical diseases which can also cause oral health diseases, that we will be separately discussing in a separate video about how dental diseases can compromise your general body health and how your general body health can compromise your oral health. So you need to keep watching this series of videos. It's upcoming in one of the series later on. Apart from that, for the children, you see, the best way to prevent irregularities or protruding teeth is to go and see an orthodontist. And the usual advice given by the orthodontist the world over is that the first dental checkup for the children is advisable at 2 years of age, and the first orthodontic checkup, and orthodontic treatment means straightening your irregular teeth which are crooked, and to straighten them up, like I said in one of my previous videos, that you need very sound, well aligned teeth in a good occlusion to have a good bite for optimal function and aesthetics. So this orthodontic treatment is relatively a 150-year-old concept where people have been straightening the teeth with various means, and it all started way back by using lots of crude mechanics 150 years back. Almost 100 years back, Dr. Edward Engel, who is considered the father of modern orthodontics, introduced the fixed appliance, and these are the braces as we normally call them, which are used to correct the irregular teeth of your child. Sometimes the children are very conscious of their, some people, so we have the ceramic braces. We can also place braces on the back side of your teeth to make them less visible if you are very conscious or the child is very conscious. Orthodontic treatment, by the way, can be done at any age. It's just not meant for children. Adult orthodontics has got plethora of options right now for a good optimal health care. The most frequent and the most recent advancement in aligning teeth is the clear aligner, and this clear aligner is also straightens up and corrects the protruding teeth or the irregular teeth. Now, correction of protruding or irregular teeth, be it for kids or for adults, is just not for having a good smile, but it is also for having a good optimal bite for proper function, as I have been repeatedly telling you. Please visit your dentist. Please visit your nearest and your near and dear dentist for proper guidance of all that I have suggested, because whatever I can talk in a few minutes, can only be covered in a few minutes. And dental science is a very wide science, so whatever problems you have, or if you have any questions, please visit your nearest dentist on this. And I would recommend you to please keep watching this video series, and we will be also talking a little bit now for a minute about how to enhance your smile, because you see a bad tooth, for example, we call this front 6 teeth as a social 6, because we tend to flash this front 6 teeth socially everywhere, more so on social media as well. And a lot of people are now conscious of it. And it's just not about aesthetics, it's also about the self-esteem and the self-confidence of the person. A person having a good smile, a person having a good set of teeth neatly arranged has a better presentation. People tend to listen to them more, pay attention to them more. We can go a little deeper down into the psychology of that whole field, but it's beyond the scope of today's discussion. But having a good set of teeth can help you. And there are certain quick fix solutions also, like veneers and crowns and caps, which can immediately solve a few of your problems if your smile is marred by either an irregular tooth or a discolored tooth. If you want teeth whitening, which I do not recommend to patients normally, But if you do want to whiten your teeth, do it sparingly, like once in 2 to 3 years, because bleaching it too often is also not good for your teeth, and you can whiten your teeth. So I am very sure that I hope I have been, not sure, but I can only hope that this series of videos of mine is helping you, and you will keep watching this. Till then, see you my friends and parents. Have a great smile.